All right. Hey, Tommy, how have you been?
I've been doing okay. I've been doing okay. Uh, School's a little
Yeah,
stressful, like usual.
yeah. I know that when we met last week, we were talking about just how you've been feeling a lot of panic attacks and how there's just been a lot going on um, with the situation that you've been going through with school, being away from your family, um, and that it's been really hard for you um, to kind of like digest a lot of the emotional and process a lot of the emotional feelings and that you've been going through. So, am I doing? Is my assessment of what we were talking about last week um, right on, what do you think?
Um, Sorry, I was drifted off for a second. Are you uh, where you were saying that having trouble with the emotions, the emotional part of it, right?
Yes.
Um,
So I was just saying,
yeah,
like, just
yeah,
that.
definitely.
Go ahead.
I'd say there's some emotional parts to it, as well. And there, the physical part of me, if you're not, feeling the weirdness in my body, the panic, and
Yeah.
and all, and not not having my medication, and the stress of school, and just kind of just feeling like I want to, with withdrawal from everything, and
Mm,
and I just sit there in my head, well, like what's gonna happen, like why am I so young and like so sick, or I
yeah.
mean I guess I just want more answers, and like I have all these doctor's appointments. I don't know. I just got no one seems
No,
to have answers.
no, I understand, and I know last week you were telling me about your high blood pressure and it coming from the medication that you're on um, that you were taking, and you had to be taken off it. So
Yeah.
remind me what was the medication for that you were
Oh,
taking?
oh, that was Ritalin. I was put on Ritalin, um, probably back in like eighth or ninth grade.
Okay.
I had an IUP. I'm not sure if I mentioned that or not. I had an IUP. Me and my younger brother did, and they did a referral and they put me on Ritalin, and that helped a lot. That definitely helped a lot.
Okay.
So that's another thing that's stressful is, it's really hard to concentrate. I have a lot of work to do for school. I'm getting close to graduating, and it just takes me a lot longer sometimes to finish some of the stuff. And
Yeah.
so I'm always going to my teachers and asking and they're great about it. They really are. Everyone at the wellness center knows me very, very well because I'm there every day checking my blood pressure with their little, you know, they're good. They're good.
Okay.
The school's
So
really good.
so just from what we were talking about and what we were talking about last week, and then also what we're talking about this week, I really the things that are really coming out to me is you talking about your panic attacks, you talking about the physical symptoms, which is just feeling stressed, depressed, anxious. Um, so I I wanted to take some time, if you're willing. I wanted to do an assessment with you. It's called the PHQ-9 assessment. Would you be willing to participate in that?
Let's go for it.
Okay. So I'm going to ask you a series of questions, and you're just going to ask, you're going to answer not at all to nearly every day. Okay.
Not at all to nearly every day.
Yeah.
Okay.
All right. So here we go. All right. Feeling anxious Feeling nervous, anxious, or on edge. Not at all, several days, more than half the days, or nearly every day.
Nearly every day.
Not being able to stop or control worrying.
Nearly every day. Well, if it happens a couple times throughout the day, let's say it happens a couple times, I can go watch, I can go watch some TikTok and usually distract myself.
Okay.
Um,
So would you say it would
sometimes
be
it's
more
harder
than
than
half the days or nearly every day?
I would say that that happens more than half the days that
Okay.
I have to, try a little harder to kind of I guess unwind or distract myself, if that
Okay.
makes sense.
Yes, no, it does. Next question is worrying too much about different things. Not at all, several days, more than half the days, nearly every day.
Um,
Worrying too much about different things.
well, some of the things I have to worry about because it's pretty, I don't know, it's like my health is, but I'd say I take it too far sometimes too. The other day
Okay.
I was Googling up some symptoms and that was a bad idea. Um, again, I would go with more than half the days.
Okay. Trouble relaxing.
I can't do that.
So
So
nearly every day.
never. Well, no, I can't say that because I can relax a little bit. For maybe like an hour here, an hour there.
So you
I'd
never
like to
have
be able to
trouble
do it
relaxing.
more. I definitely do have trouble relaxing.
So
I
would
would
you
say
say, go ahead.
um, yeah. What were the options near the
Uh,
bottom?
Not at all, several days, more than half the days, or nearly every day.
Go several. Go one up from the bottom. Go several.
Several days. Okay.
'Cause
Um,
yeah, yeah.
Being so restless that it's hard to sit still.
Yeah, I just realized that my leg was twitching, and
Huh,
it probably has been for the last couple of minutes. So yeah,
okay. So you'd probably say nearly every day.
yeah, yeah, that
Okay.
probably happens a lot.
Becoming easily annoyed or irritable.
Uh, I get a little frustrated. I mean, with my symptoms, and it's frustrating, but I don't really get that frustrated now. I mean, and it doesn't get to the point of like, I don't know, anger or
Okay.
irritability.
So
It's not really focused on anybody.
would you say it'd be not at all or several days?
I would say not. I would say not at all.
Okay. Feeling afraid as if something awful might happen.
Yes, yes. Not as soon as I wake up, but maybe like an hour or so after I wake up, if I start to feel like my neck, um, start to tense up, my muscles
Okay.
tighten up, and it'll start to
So
hurt, and then I'll start to panic. That happens every day.
happens every day.
It doesn't
Okay.
always turn into a panic attack, but that's every day.
All right. All right. Um, so please take a moment just to sit back and just listen to these next questions. Um, what is your age range? You're 19, right? 19 or 20?
Um, I am 20 years old. I'm 20 years
Okay. All right. Have you ever received treatment support for your mental health problem?
I've talked I've talked to some people about it before. Um, Counselors, I guess, like in school and stuff. There's one
Okay.
at my school now that I talk to.
Okay.
She's really good.
So you're receiving treatment or support right now?
Yeah, I mean, I don't know if I would call it like treatment. So they're I get a chance to see them on a fairly regular basis. It was actually her that referred me to you.
Okay. All right. So after taking this assessment, the results indicate that you have been experiencing some signs of moderate anxiety. These results are not meant to be a diagnosis, but you can meet with your doctor or therapist to get a diagnosis and or access to therapy or medications to share these results with someone that you trust, and to be a great place to start. So what we're doing right now is a great place to start. So um, so what I want to do now is to now that we've gone through this assessment and we see that there's a moderate anxiety that you're going through, I want to do a treatment plan with you. Are you
Okay,
are you okay with that?
go
All
for it.
right. So so the problem that I've been seeing from what we've been talking about is that you have a lot that you're worrying, that you have a lot of worry, that you have a lot of that is turning into panic attacks, that you're getting stressed, you're getting depressed, and you're getting anxious. So um, so excessive or unrealistic worry that is difficult to control, occurring more days than not for at least 6 months, um, about a number of events or activities that that it can result in tiredness, restlessness, what you were talking about, shakiness of the leg. Um, so and also you can get shortness of breath, dry mouth, uh, trouble swallowing, nausea. What you were talking about earlier, just having the high blood pressure. So, the goal from this treatment plan is to reduce your overall frequency or intensity of the duration of your anxiety, so that your
Okay,
daily
that sounds good.
functions is not impaired. So you can be able to go to class, be able to focus on your class work, and then you can be able to graduate on time. I know that that's an important piece for you is to graduate on time. So
Yeah.
we have to learn and implement some coping skills that result in a reduction of anxiety and worry and improve your daily functioning. So what I want you to do is to focus on the level of uh, anxiety you are having at this moment.
Right
And
here, right now.
yeah, right now, the level of anxiety, the level of stress
Okay.
that you have, and I want you to um, describe to me your past experiences of the anxiety and their impact on your functioning, and um, to focus on the excessiveness and the uncontrollability of your worry and your anxiety that you've had during those moments. Does that make sense from what I'm asking?
Um, I got to think about like my level of worry and what else?
So your level of worry, the level of anxiety that you've had in the moment of the the tension that you've had that we've been talking about. So really take
Oh,
one
during the panic
situation that
attack.
you've had. Correct. So name
Okay.
one situation during your panic attack
Okay.
that
Okay.
I want you to almost, that's why I was asking you to sit back and pinpoint a
Oh,
certain
okay.
panic
I
attack
wasn't
that
sitting
you've
back.
had.
Let me sit back again. All right. We gotta relax. All right. What am I thinking? What am I feeling?
Yep. Of a situation that you've had in the past that has caused you to have a panic attack.
A lot of worry, a lot of what's wrong with me? Am I gonna die? Am I gonna just die? Okay, I'm, my breathing will start to get a little shallow. Right now as I'm thinking about it, as I'm talking to you about it.
Mm-hmm.
Um, I, I don't know. I don't necessarily have a lot of reasons why I should be thinking this. I don't, I don't have like a congenital disease or anything. But I know that, you know, the my arms are all tense. My legs are tense. My the tip of my toes are sticking straight up, and I can't even. Okay,
Yep.
let's say I really want to finish school, and I really, don't want to quit and go home.
Mm-hmm.
Um, I'm the oldest. My younger brother's got some similar issues. I want to I want to finish. I'm so close. Um, if I could just, I guess I'm
Okay.
worried that I will just, you know, let myself down, let everyone down, and not be able to finish and just be sick in a bed somewhere. That's what I picture.
Okay.
Being weighted down.
So this is great. So now what I want you to do is to now sit back. I want you to want you to put your feet planted on the ground. I want you to sit up straight. And what I'm gonna ask you to do is I'm gonna ask you to do some mindful breathing techniques. During these moments, I want you to clear your mind of um, of the moments of anxiety, the moments of stress, the moments of that are causing these panic attacks. And I want you to do some breathing techniques. Now, let me know when you're ready. When you have your feet planted on the ground and you're sitting up straight.
I'm ready.
Okay. So I want you to start breathing through your nose, and you're going to start slow. You're going to breathe in, hold for 2, and breathe out. And you're going to do that for about 3 or 4 times. And then you're going to take a break and you're going to really examine where your mindset is at. And then take another deep breath in, hold it for 2, release. And we'll do that about 3 rotations. And then once we're done, this should be able to help you to reduce your stress level by having a mindful breathing. When you're focusing on your mind, your breathing, and you're not focusing on the anxiety, the the stress that you're going through, but you're focusing more on your breathing. Make sense?
Yes.
So let's try that. We'll do 3 rotations. We're going to do sets of 3, 3 rotations.
I'm sorry. 1 second.
All right.
Again, wait. All right, I might die now. All right.
All right. You ready?
All right.
All right. So we're going to start breathing in, out. Breathe in, breathe out. Breathe in, breathe out. Take a moment to take a moment and then breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. So how you feeling?
Like I could take a nap.
So I think that I think that this is a good treatment plan for you to do in the moment of your panic attacks. When you start feeling that, when you start feeling it coming on, and you know that it's coming before it's full blown panic attacks, that you can start doing these mindful breathing techniques. You have your feet planted on the ground in a chair that you could sit up straight, and you breathe in, breathe out, and then you're just focusing on those breathing, on the breathing.
I could
Sounds
try
good.
that.
All right. So the next time we meet, we'll go from there, and we'll see how the breathing techniques went.
Okay.
All,
All right, sounds
all
good.
right. All right, Tommy. Well, thank you for coming in, and I look forward to our next session.
Okay.
All
All
right.
right.
Bye.